We asked 3 experts about antimicrobial resistance and antimicrobial use in European hospitals. This is what they said.
Antimicrobials, including antibiotics, are one of the most important therapeutic discoveries in medical history. They have revolutionized how patients with infections are treated, in particular in hospitals. However, microorganisms, mainly bacteria, can develop the ability to resist these medicines that were designed to kill them or stop their growth, so they are no longer effective to treat infections. This is what we call antimicrobial resistance.
Antimicrobial resistance is a problem, and I would say it's a rising problem in European hospitals. At the moment, we know that in terms of healthcare-associated infections, 1 of each 4 infections are caused by bacteria that are resistant to the most commonly used antibiotics for the purpose. That is worrisome. We try to monitor, and we do monitor, a bunch of bacteria resistance combinations, and 3 of them are probably very important, and they are scheduled by the European Council to have clear targets in 2030. One is Escherichia coli and its resistance to cephalosporin. The other one is Staphylococcus aureus and its resistance to oxacillin or methicillin. And the other one is Klebsiella pneumonia and its resistance to carbapenems. We have good news about Staph aureus. Resistance in Europe is coming down, and for instance in my country, in Portugal, it has come down from 50% to 25% in 10 years. But on the other hand, in terms of Klebsiella pneumonia and its resistance to carbapenems, it's going worse and worse every year. If you take all infections caused by Klebsiella pneumonia, you see that 1 in every 4 infections, Klebsiella, is resistant to carbapenems, and that is a clear problem because Klebsiella is a bacteria that we have with us. It is a bacteria that frequently causes infection, and it's becoming resistant to one of the most broad-spectrum antibiotics, and we have to use new antibiotics for the purpose.
We need effective antibiotics in medicine for treatment of bacterial infections and prophylactic use in surgery or oncology. The appropriate antibiotic use and sufficient infection control are key to reduce the emergence and the spread of resistant bacteria. Improvement can be achieved by establishing and strengthening antimicrobial stewardship programs to ensure the appropriate use of antibiotics, including the prudent use of broad-spectrum antibiotics and the further reduction of prolonged antibiotic use after surgery. And by ensuring a sufficient number of single rooms in each European hospital for proper isolation capacity for patients with these resistant microorganisms. Furthermore, by strengthening infection prevention and control measures, starting with hand hygiene and the use of alcohol-based hand rub. And last but not least, by improving the monitoring of antimicrobial use and antimicrobial resistance. The situation regarding antimicrobial resistance and use varies across Europe. ECDC provides easy-to-use tools for each country in order to identify gaps and to set improvement targets for safer hospitals for all patients in Europe.
These findings, tools and indicators are available as part of the 3rd ECDC Point Prevalence Survey of healthcare-associated infections and antimicrobial use in European acute care hospitals 2022-2023. Visit ecdc.europa.eu.